How does a cancer biopsy procedure work? Imagine trying to solve a mystery about a suspicious lump or abnormal area in the body. A biopsy is like gathering clues to find out if cancer is involved. It's a key step in understanding what's going on inside. When doctors suspect cancer, they need to look at the tissue or cells closely under a microscope. This helps them see if cancer is present, what type it is, and how advanced it might be. The process of doing this varies depending on where the abnormal tissue is located and what kind of biopsy is needed. Usually, it starts with preparing the area. The doctor cleans the skin or surface and then numbs it with local anesthesia. This means the patient stays awake but feels little to no pain during the procedure. There are different ways to take the tissue sample. One common method is a needle biopsy. A thin needle is inserted through the skin into the suspicious area. To make sure the needle hits the right spot, doctors often use imaging tools like ultrasound, X-ray, computed tomography scan, or magnetic resonance imaging. These tools guide the needle precisely. Fine needle aspiration uses a very thin needle to draw out fluid or cells. Core needle biopsy uses a larger needle with a cutting tip to remove small cylinders of tissue called cores. Vacuum-assisted biopsy involves suction to pull tissue into the needle, often collecting bigger samples. Sometimes, a larger sample is needed or the area is hard to reach. In these cases, a surgical biopsy is performed. This involves making an incision to remove tissue, sometimes with the help of a camera or scope. For skin lesions, doctors might use a punch tool, which is a small circular blade, or a shave technique to remove superficial tissue. Once the sample is collected, it is carefully preserved and sent to a pathology lab. There, a specialist called a pathologist examines the tissue under a microscope. They look for cancer cells, abnormal structures, or other clues. After the procedure, the site is usually closed with stitches or covered with a bandage. Most biopsies are minimally invasive, so patients can often go home the same day. Some soreness, bruising, or minor bleeding might happen but usually gets better quickly. The results from the lab help doctors confirm if cancer is present, identify its type, and decide on the best treatment plan. Families and caregivers should know that waiting for results can be stressful, but clear communication and support are very helpful. Understanding how a biopsy works can make the process less intimidating and help loved ones feel more prepared for what's ahead.